So I kept talking, kept talking. By the time I was finished, most of the people were receptive, grateful for my presence, for the things I shared with them. But this one young brother in the room, he was unmoved, untouched, disconnected the whole time. And so I asked the warden as they were filing out if I could have some alone time with this young man. And he said, "Mr. Scott, that's fine, but you need to have armed guards around you when you're with him." And I was like, man, what'd he do? It didn't matter. I said, that's fine, but can they just give me some space? Because I think it'll be counterproductive for our time together. So anyway, I sit in front of this young man, and I just sit in front of him, and I'm just trying to, his head is still down. His head is he's just down. I said, man, did you hear anything I said today? And he just looked up at me. And he had this darkness in his eyes that you get when you lose somebody close to you. I've had that look. I've seen that look so many times. And so I asked him, I said, man, did you lose someone recently? He looked a little surprised. And he had tattoos on his neck, a tattoo on his face, on his knuckles. He said, yep. I said, man, and I assumed maybe it was a gang member, a friend of his who was in the streets with him. I said, was it one of your guys in the streets? He said, no. I said, man, who'd you lose? He said, my little sister. I said, you lost your little sister? I'm sorry, man. Like, how old was she? He said 3 months. 3 months old. I was like, man, did she have like a birth defect, or like, did she have something wrong? Like, what happened to her? He said, my mom's boyfriend raped her, and he destroyed her insides, and she died. She died. He said, and I should have been there with her to protect her, but I was in here. She died because I was in here. What do you say to students and young people, or anyone who's experienced trauma like that? How do you reach young men and young people like that, with that kind of pain, with that kind of trauma, with that kind of brokenness, with that kind of anger, with that kind of regret? How do you reach that kid? What could you do? What could you say? Who must you be to reach that kid? That's what I want to talk about today with the time we have together for these next 30 minutes. I'm absolutely convinced that to reach that kid and kids like that, what you don't need is more pedagogy. What you don't need is more technique. What you don't need is more formal education. But what you need is the ability to cultivate healthy relationships with that kid and kids like that. Because if you can build relationships with kids like that, you can not only improve student attendance, you'll improve classroom management, you'll reduce the number of fights and truancies, you'll reduce the number of problems you have in class, you'll increase and improve parental involvement, and so many other things. You'll reduce your stress levels. You'll save a lot of time from babysitting kids. If you learn how to cultivate healthy relationships with individual students, and you learn how to develop a relational persona